At a state prison, a parenting group facilitator asks a room full of new and expecting incarcerated mothers, "What is your biggest fear about being a parent?"
And one mother said, "My biggest fear about being a parent is that I am going to be no better to my baby than my mama was to me." And the group facilitator said, "Well, tell me more about that. How are you doing with that?" And she said, "Honestly, I truly don't know. I'm not beating my baby, but I'm sitting here in prison pregnant. So what am I supposed to do?"
What we know is that between 1991 and mid-year 2007, the number of parents who were held in state and federal prisons increased by 79%. And it is estimated that 52% of state inmates and 63% of federal inmates are parents of minor children.
We know there are over 200,000 women in jails and state and federal prisons, and there are over 14,000 girls in juvenile detention centers. An estimated 12 to 21,000 pregnant women are incarcerated every year.
The majority of incarcerated people are more likely to have mental health problems, to have substance abuse problems, to use alcohol, tobacco, to have violence exposure, to have experienced homelessness or poverty. And all of these social and medical risks are associated with poor maternal, fetal, and infant outcomes. Mental health and stress are known to be related to pregnancy outcomes and maternal health. High stress, anxiety, or depression is associated with risk for low birth weight, preterm risk, some birth defects. And it can also affect maternal behavior, willingness to eat, ability to sleep. Actually, stress can have even longer-term effects on offspring. There's sort of a transgenerational risk to offspring of incarcerated people. One of the things that can buffer stress is social support.
Traditionally, pregnant women in prisons receive limited social support and prenatal education during pregnancy and delivery. Women who are incarcerated must give birth under supervision from a corrections officer without support from family or friends, and in some states, women are shackled during active labor, creating additional stress during the birth process. In Minnesota, the Minnesota Prison Doula Project is working to change the birth experience for pregnant incarcerated women.
A prison doula is a very important person in the life of an incarcerated pregnant woman because she becomes the primary source for prenatal education, emotional support during pregnancy, and physical comfort during labor and delivery.
So she gets 2 one-on-one prenatal appointments that include prenatal education, emotional support, assistance with preparing a birth plan. The doula also provides labor and delivery support, so she meets the woman at the hospital after she is transferred from the prison. And she provides emotional support, physical comfort, and assists the mother with making informed decisions in this context.
And then a big part of our role, which is what a lot of the women say is the most important part, is that they go the day the baby is taken away from the mother and they stay and sit with her that whole day.
So this is a really intense emotional experience for the mom, and the doulas can be there to support them through that. The doula plays this critical role of providing emotional support in that setting. We have very healthy babies in the context of this program. We've had 35 spontaneous vaginal deliveries and 4 C-sections, average 7.41 pounds, and again, none of the babies have been born low birth weight. Gestational age is right where it should be, 39 weeks and 3 days, and none of the babies have been born preterm.
We also want them to be born healthy because premature babies are very, very expensive. The cost difference for a mom and baby in the first 2 or 3 days in the hospital is $50,000.
At the 12-week follow-up, women are reporting significantly fewer depressive symptoms, more confidence as parents, more support from other women in the prison, more support from prison staff. One mom said, "Having a doula there made my experience a good one. It helped a lot. You have to find something positive about your birth experience while you're in prison, and my doula helped me achieve that."
We can offer women all kinds of great programming. I think we do, but one of the primary things we do is we just let people grieve. I mean, women are absolutely broken-hearted about being away from their children.
Like pregnant women in prisons, pregnant women in jails are vulnerable to the stresses of incarceration. However, women in jails serve much shorter sentences and face unique challenges that make intervention more complex.
Particularly in jail environments, it's a pre-sentence, pre-trial facility. The average length of stay is 7 days. However, most women are gone within 72 hours. So that opportunity to make that connection with a woman to find out where she's at with her health, with her pregnancy, is really limited.
The CDC estimates anywhere 6 to 10%. If you look at jails reporting from large urban areas, you see rates between 20 and 30% of women who are testing positive for pregnancy. Pregnancy is a time where many women, incarcerated or not, are open to making lifestyle changes, right? They want to take better care of their bodies, not only for themselves, but also for the baby that's developing inside of them. We're really surprised to see that longer stays of incarceration were actually associated with healthier birth weights. And there could be any number of reasons for that, the safety of the jail environment, removing from other life stresses. But what this really said is the group that we need to intervene with are the group that's not incarcerated for a very long time. This group might really be in need of services. We see incarceration as an opportunity to identify pregnant women for a key part of intervention to start services.
I think there's a challenge in terms of access to care out in the community. Inherently, those connections with public health aren't there.
Upon re-entering society, former offenders often struggle with substance abuse, lack of adequate education and job skills, limiting housing options, and mental health issues. Many pregnant women and new moms need additional support to ensure they provide a safe environment for their child.
But I would say folks are dedicated and they're committed, and we want to do this, and we want to do this better. I think there's opportunities with every correctional health agency to make a connection with local public health. I'd like to see every pregnant woman have a referral to their local public health agency upon discharge. I would love to be able to have my staff connect with every pregnant woman in custody.
For more on pregnant incarcerated women and their children, visit these links.